Welcome to JoyMed podcast, brought to you by Safe Haven, a program of the Medical Society of Virginia. I'm Melina Davis, your host. I'm the CEO and EVP of the Medical Society of Virginia. We're thrilled to announce the launch of this new podcast series, where we'll delve deeper into the challenges faced by healthcare professionals, explore strategies for resilience, and highlight the support systems available to them. Each episode will feature expert insights, personal narratives, and practical tools to help foster a healthier, more supportive environment for our healthcare heroes. Make sure to subscribe to our podcast so you don't miss this important series, and share it with your friends and colleagues. Together, we can create a culture of care and support, ensuring that those who care for us are cared for as well. Thank you for listening, and we look forward to continuing this journey with you. Welcome to the JoyMed podcast. I'm Melina Davis. I'm the CEO and EVP for the Medical Society of Virginia, and I'm your host today. I am thrilled to share that we have a very special guest with us today, Commissioner Nelson Smith of the Virginia Department of Behavioral Health. And we are just thrilled you're here, Nelson. Thank you for joining us.
Yeah, this is great. I'm excited.
You and I have known each other for a couple of years now because we've been working together, our organizations, on some really important mental health work in the Commonwealth of Virginia. But before we get there, I want other people to get to know you a little bit. Sure. Tell us how you came to DBHDS and why you came.
Yeah, the why. It's a weird journey. You never really know how you're going to end up somewhere. But especially when you're in the middle of it and you really look backwards and see how you've been led to where you are at that point. My journey was a little asymmetrical. I spent my early adult years in the Army. And yes. I did 20 years in the Army Special Forces. I retired, got my MBA, got into healthcare administration, and I landed back here in Virginia.
You've worked for like 3 hospitals, right?
That's right. That's right. My first hospital was in California, in Southern California, and that's where my twin girls were born there. So I've got California people in my family now. Anyway, we landed back here in Virginia. I'm from Southwest Virginia, a little town called Gate City. So this was a nice kind of in-between. Yeah. My wife's from Northern Virginia. But yeah, healthcare administration, I always joke and say it landed on me. I wasn't, you don't get out of the military, especially what I was doing, hunting down, terrorists all over the place,
right,
to healthcare administration.
That's such a switch.
It is very much so. You never know what God has in store, but it was an interesting switch. There were some days, and many of you out there in administration can identify with this. There were some days where I would rather be back in Afghanistan.
Oh gosh, that's crazy. It's a crazy world, and people don't know how hard it is to work in healthcare.
Absolutely,
it's very hard.
It's relentless. It's 24/7, 365. When people are on their vacations, we've got our providers out there, grinding out middle of the night on Christmas.
And accompanying people through some of their worst moments in their life through that experience. It's hard.
Yep. And so my why did I do this? I spent a lot of time in the emergency rooms, and I saw those families, and they bring their children in, and they don't know what to do, especially in mental health care. And it was just heart-wrenching. And I knew that the system wasn't working effectively. When I would get a phone call from the previous commissioner asking me, as a provider, if I could help find a bed for a single individual. And I was like, wow, ma'am, don't you have a state to run? Right. Why are we negotiating on individual people? And I just knew that the system was really broken. Does that make sense?
Yes, it makes perfect sense, because there are waiting lists and nobody knows where the resources are. And frankly, there just aren't enough of them.
Right. So again, if you had the commissioner calling an individual provider for a single person, not that one person is not important.
Sure. Yeah.
That means the system.
It's everything, but the system needs to work, so that's not needed to make it work.
That's right. And so I just knew it was the right opportunity. And, I knew Governor Youngkin, what he stood for, and as many people should know, is that he's all in on this. It's the most real thing, the biggest thing to them and their family as it is to mine. And so I knew that combination, we can just go get it.
It's going to be powerful.
It's going to go. We got to go, like he said, both feet on the pedal, that Virginians are broken. That's what he heard all over the place. And so I sat down with him the first time, and, he asked me a lot of those questions, very specific about what's going on in the system. And I remember he's like, he was asking me very specific questions. I really had no idea, to be honest. And I was like, honestly, sir, there's probably like 80% of this job I have no idea how to do. Can you imagine saying that?
What a great answer, though, because it's clear and honest. You don't need to know the answers going in. You need to know how to figure it out.
That's right. Well, then he talked about growing and stretching into roles that you've been given, and then he stopped and he's like, honestly, I've never been a governor before. I think we'll be in this together.
I love that.
So that the cool part of that is, like, we're in this together. Let's figure this out. We've got to take it day by day, and it's been really cool. So,
as you and I have had different conversations, one of the things I've been so impressed with is how this is a mission for you. And you took sort of that special forces attitude and mission focus into this job to help people. And I think that's powerful. I don't think people understand that. But why is that important for you? And how does that affect how you lead your department?
Yeah, thank you for saying that. Very kind.
It's true.
Because, and I'm not saying this to be overly dramatic, I believe it, is the more inefficient that we are as a system, the more that people are suffering, the more this is a real thing. And I reminded our executive team of this when I first took over, is that people are dying.
People are dying.
And
big statement. Let
it sit for a minute, because if they don't know where to go, they don't know how to access services, and people know it's sort of like, it's a secret deal. Hey, do you know somebody? How do I do this?
Right.
And we're better than that, right?
We should be better than that.
That's right.
Yes.
And you say, well, it's state government, and I heard that a lot. Well, it's state government, and this was early on. And I got to the point where I had my executive team in, and I said, I reject that wholly.
I love that.
As a taxpayer, I don't want to pay, for nothing. I want to know that it's the best.
Right.
We are owed things that aren't the best?
Yeah.
And so, and it wasn't like the agency wasn't doing anything. They were doing things, but it's like, you pull the reins off of people and let them go.
Yes.
And they've, it's just been really cool to be part of, and, challenging people, set targets. We've got our goals, we've set goals, and we put it in the public square too. And we march towards those. They're measurable, they're quantifiable. It's a different way of, as the governor said this, I like it, is we're running the state at the speed of business. Right?
Oh, I like it. So one of the things I think is so important is people are motivated by a mission, but they're also motivated when you trust them to do their best, right? So my sense is you've seen a pickup in how people can get things done. Are you seeing that? And
I'd like to think so, but it's we can ask all our folks who I completely trust and love them to death.
Yes.
I mean, almost 6,000 individuals working for DBHDS are getting up in the morning to do their very best in every part of Virginia. And that is absolutely true. I've seen that. And like you said, trusting people. Like, people aren't waking up. I say this a lot in our leadership courses that we do, is people are not tying their shoes in the morning and getting dressed, and they're in the mirror like, man, I just can't wait to suck at my job. I can't wait to get there and just screw up. Man, I've got a laundry list of things that I'm just going to, and it's funny when I say that, but and I know some people are like, oh yeah, well, there are those people, maybe, but not at large. So then if it's funny, it sounds funny.
Right.
Then something else is going on. Right. And generally it's going to be some sort of communication breakdown or misunderstanding. Yeah. And so we start with that, and you build into that trust and empathy. And we have this thing called One DBHDS, which is, you talk about, I don't know, you bringing my past into this, running it like it is. Yeah. I've spent a lot of time thinking about what is it that made those men do what they did up into giving their life.
Right.
And it wasn't for titles or money.
Right.
The average Green Beret or Navy SEAL doesn't get paid that much.
Right.
Right. It's the Army.
Right.
So what is that? And it was like, you knew that you were part of the best. Your training, I mean, you knew that we liked winning.
Sure.
And it was that mission
Yes.
of being part of something bigger. And so how do I do that? And I've brought that into every part of my new civilian life, is how do I gel those people together and empower them to where they feel like they're part of this thing.
Right.
And so this is where we've got this new 1DBHDS mission, is that they're part of it, right? Maybe they work in a state hospital.
Right.
But they're part of the 988 crisis build out that's saving thousands of lives. They're part of the developmental disability, opioid reduction in related deaths. They're all part of that whole thing. And that's pretty wild.
That is.
It's a lot.
Well, we all want to make an impact, right? I believe in Americans. I believe in Virginians. And I believe that we actually do want to make things better. We're one of the most innovative, hardworking cultures in the world. And 99% of people show up wanting to be part of something that is valuable and that they could contribute to. And I think you're tapping into that with something that right now is such a important topic in families, to young adults, to older adults. I mean, it really doesn't matter who you are. You're affected by behavioral health these days.
Yeah, that's right. It's funny because when we were coming up with the governor's Right Help Right Now plan, it was a whole of government, and it touched every agency within the Commonwealth. I mean, you had DMV. How can they maybe put it on the driver's license? Like, they're just discussions all over the place. And over the past years, you can say that the stigma is lessening because more people are talking about it. It is a kitchen table topic now.
I agree with that.
People are just trying to figure out what's going on.
Right.
And how is this happening?
Yeah, one of the things we found at the Medical Society is if we can get everybody talking about it, we can make it an open conversation and reduce that stigma. The next real hurdle is to get people that right help that they need in the moment. And some people are early in the conversation and need light care, but some people are in the deep end of distress and need deeper kinds of care.
Yeah.
And so how do we get people to the right place, especially now that we know that there are so many limited resources? So what have been some of the ways that you've started to challenge the system and try to get people better access?
Well, this personally, is when we looked at Virginia and the shortage of providers that we have, we can talk about growing our own all day long, but it's not like, there's a factory where we're, punching out psychiatrists or something.
Right.
Like, it's not a thing.
National problem.
You can't run to the store and just grab,
Right.
And it takes a long time. And
More than 12 years.
That's right. And there are less people entering in the field of healthcare, according to the study that I saw.
You're right.
Before
all studies, right? Yeah.
Right. And so it's like, okay, what do we just like being a good Green Beret is I can't complain and look about the things that I don't have.
Right.
It's a different way of looking at the problem set. It's looking at what we do have. Take inventory. And then when I learned about the Virginia Mental Health Access Program, I was like, oh, wow, this sounds like something that I'm used to, which is this, it's a force multiplier.
Yes, I love it when you use that term about this program. Why don't you describe first what it is, the Virginia Mental Health Access Program?
Yeah, it's really, that is innovative, and y'all were doing that before I was on the scene.
Well, Dr. Sandy Chung is her brainchild, and we jumped in with her full force.
Yeah. She's wonderful. She's on our board now.
Yeah.
She's just a terrific human being, and we're just blessed to have her in the Commonwealth. And so, again, talking about what we have and what we don't have, and psychiatrists are just in high demand and short, they're not enough of them. And pediatricians, they're out there and they're seeing these families all the time, and they're dealing with mental health care, substance abuse issues in their practices, and they just didn't know what to do. Physicians, when they go through medical school, they go through and I say dabble in all the different fields.
They learn a little bit about it all, right?
That's right.
Yeah.
That's right.
Yeah.
And so we can't expect them to remember all that. Then they'll go on and specialize in something. So what this program was really unique in that it really does provide those supports, basically like a total recall of that few weeks that they got, right? And helps wrap them in case management and supports, prescribing, whatever they need to help them feel more confident in their practice so they can make a bigger impact in their community and not feel helpless.
In many ways, I think the trainings that are offered through the Virginia Mental Health Access Program, or VMAP, as we call it, really extend their education well beyond what they were able to get as a generalist or a ped specialist.
That's right.
But really importantly, too, it also pairs them with a collaborative provider, a psychiatrist who's always on call, so that if somebody is in deep need, they can collaborate with that expert on the care of that child or that family member. Even moms now are able to provide help too, and other parents. And also be able to create a relationship with that psychiatrist if that's needed, or another one. So it really is a great extender and, as you say, force multiplier.
Yeah, it's really creative, and it solves a problem. Again, like instead of talking about things we don't have, let's lean into the things that we have. And, the collaborative care model is, I think everyone could agree, is really best. And the individual Virginian doesn't care what banner that you fly. What
Right.
Okay, I'm DBHDS. You got to go to a CSB. You got to go to a VDH.
All the letters.
You got to go wherever. You got to go to a pediatrician. Well, let me get a referral and go to a podiatrist. And so it's like spread everywhere, right?
Yeah.
And it's cumbersome.
It's confusing.
I feel like we're at the beginning of all of those things are starting to converge. And I think that holistic care model is really going to be, in my opinion, what we should be moving towards, but that's a lofty goal.
Well, we've been able to expand VMAP coverage from prenatal all the way to postnatal and the care for the child up to 24. And now we're moving into introducing another program together, right? Health Haven Recovery, specifically for recovery and substance use disorder. And the idea is to keep going up the adult chain. And I think geriatrics might be the next piece that we choose to work on because we see the effects it's having in the older population as well. How can we go to this model to serve and extend more people?
Yeah, these are the beginning, the dominoes that we're doing here, and I think it's going to take effect in the future. But I've wanted to get this thing going.
Yes,
I want
you have.
all of it right now.
You've been carrying the flag and saying, I need it all now.
Yeah. Because, again, the urgency in action is that people are hurting.
Right. Yes.
And let's get all the things that we need and move now.
Mm-hmm. Yeah.
Unfortunately, we've got a balanced budget. So
wow. But we're starting, right? And that is, to your point, if you don't start something, right, you can't expand the effort, and you can't bring other people to the table. So in this budget, I think we're able to start some pieces and parts with these other programs, and that's meaningful.
Yeah, I always say one is more than zero.
That's right.
That's right. We're okay. Right. We're going to keep moving.
And we've got some staff with us in the studio, and I know that their determination to do what they can with every penny to get more resources to people and stand it up. Very important. So our team working with yours and people across the Commonwealth and hospitals and practices and community service boards and so forth, free clinics. I think we're all trying to be a team together, a force together.
It's funny being in this seat early on. I did a lot of listening and traveling through Virginia. I got to be a tourist in my own state, which is cool. There are parts that I've never seen before. But it's fascinating when you get a lot of people coming to your office early on. By the way, I make jokes. My jokes got funnier when I got this job.
That's cute.
I'd say that
that's cute.
But there were a lot of people, advocates, all the different associations of fill in the blank, VA, something another.
Yeah.
And you've got all the different players, right, in healthcare, and everybody is doing good thing. Everyone's doing a lot of good things.
A lot. Yep.
But in part, I feel like it would be nice, and this is really a lofty, altruistic.
I want you to say what your goals are.
Because you've got all these people, and they're all rowing separately in different, but like, let's all row together. That would be really cool to figure out how we can do that, right?
Yes.
All the different people.
Yes.
And again, the Virginian, the individual consumer doesn't care about all those different things. Like, frankly, so how do we do that? And I don't think we can get to that, because you've got every organization has its own.
Well, there's competing agendas, right? Where people have different things that they value, but they do all still, in general, they're all trying to work toward the same thing.
Yeah.
Can we pick things to concentrate on together? I think you're helping make that happen with behavioral health in a way that we've not seen before in the Commonwealth.
And that's one of the unique features, I think, of the Right Help Right Now. We did try to bring people in, and we had these work streams with different stakeholders involved. And so, if we keep building, like you said, keep pushing, I think we'll get there. But, me, it's frustrating. I could see the win.
I know.
Everybody's
you want it all done now. Yeah. The rest of us want you to stay in this job forever.
Oh, man.
I know.
Thank you.
It's a lot to do. I don't think people understand how hard it is to be in a role like yours. It's a 24/7 kind of on call, and it's grueling as well.
Well, that's very kind of you again.
Yeah.
But it's been the best job I've ever had. I mean, outside of, it's the mission is just beautiful.
Yeah.
And I don't, bringing my team back and bringing everyone unscathed was just a beautiful thing too, right?
Yes.
But this has been in size and scope, and then the team.
Yes.
To see the passion.
Yes.
I make a joke, by the way. I can't swing a book and not hit PhDs and doctors. We have so many smart people in our agency. It's tremendous.
Yeah.
And then to know the impact that we're making.
Yes.
It's
a gift.
Amazing.
Yeah.
And I don't take it for granted for 1 second. And I don't think it's hard.
Yeah.
I really don't. You know why?
Why?
Because I have an awesome team.
You have a great team.
And that makes it easy.
Yeah. I think that too. So, we talk about the Virginia Department of Health a lot, and I think your agency is an unknown part of the health network. But what we're learning is mental health is so important to overall health, right? How do you think those things help one another? How are you helping advance health in general with your work on behavioral health and mental health?
Yeah, my colleague, Dr. Shelton, and I talk about these things. And again, they're part of, the work stream and Right Help Right Now.
I know you guys work together so closely.
Well, we're fellow Southwesterners, too. She's from down there. We joke like, oh, yeah, we're up in the big city now. Well, underpinning, I would say that mental health is the underpinning of, like you said, your general health. Mm-hmm. And if you're depressed, then you don't typically take care of yourself. Mm-hmm. And so we're just pushing a lot of awareness in that area, especially around opiates. That's our big intersection. Mm-hmm. As you know, when we started off this journey, we set off a lofty goal to reduce opioid deaths by 20% during our tenure here. Mm-hmm. And we set that goal, and that was just to get us back to pre-pandemic levels.
Right. Which were already terrible.
And so we have hit that number, by the way, and
That's
it's about 25%. 25%.
That's huge.
Well, again, awareness is a big part of that. We've got our Revive program, and we do work with the Department of Health for distribution of naloxone, Narcan, which is life-saving. And so that, to me, is a huge win and show a clear partnership between government agencies. Mm-hmm. And again, the First Lady, it only takes one campaign. Mm-hmm. They have personally helped people train on how to use Narcan.
Right. So that you can help save somebody in your community quickly.
That's right. Yes. You should have it in your glove box. It's unfortunately like a bee sting kit or something now.
Yeah.
But that to me is the biggest example of how we've worked together on, it's a public health issue.
Yes, it is a public health issue. And it is destroying communities.
Right.
Not just in Virginia, but along the Appalachian, but all over the U.S., really.
Yeah. Well, and then another part is mental health care with our youth. And so that's not new, but I'll tell you, the Secretary Kelly is all in on this with the governor and the first lady. Mm-hmm. There's a new initiative called Reclaiming Childhood. Mm-hmm. And that's such a great name or initiative. If you just think about that, their childhood has been claimed by something else now.
Adulthood.
Our kids are absorbed with cell phones, social media, and it is impacting. I read the book Jonathan Haidt, so I'm going to get over my skis, but it has been a tremendous impact to the globe with the introduction of this. It's not just in the U.S.
Oh yeah, it's true.
It's been a hockey stick spike globally when it comes to mental health care, depression in youth.
Yeah,
and it's clearly associated with those things.
Clearly. I think all the research is showing, and we need more research on the topic, but kids on bikes, you got skinned knees.
That's right.
I think I had a brother run into a car once on his bike, but not much else. Right?
That was old. I saw me. I love the memes, and it was like, how do you know where your kid is back in the 80s?
Yes,
you see a pile of bikes out front.
That's right. That's right. I'm a child of the 80s, so I did grow up.
Yeah.
Like that. Where are my brothers? Oh, all the bikes are there.
That was the best.
Yeah.
And so, how do we reclaim that as a society? And that's one of those. It's going to take all of us.
Yeah.
And get to a tipping point. Frankly, I mean, is it an endemic, pandemic? I mean, the social media issue?
Yeah, I think so.
We should treat it like that.
I agree. I think it's hard because we're all addicted to it now, right? It's hard to give up something that your brain enjoys. It creates a dopamine fix, which keeps all of us attached to it.
Yeah.
In children, that can be devastating because they don't even have the controls that we have as
That's
adults.
Right. The evidence is the prefrontal cortex is not developed until they're at least 14.
Yes.
And so then, what limits and barriers should we get on? I mean, it's, should we wait on the General Assembly or Congress, or as parents, as family members, community members, what is it that we can do to make those promises to limit our cell phone use? Those are the things that we're trying to get out there.
Yeah.
And that's the messaging.
And so part of that is a changing in attitude, but also a decision as a population to put things down and re-embrace social activity, I think is what I hear you saying.
That's right. Get out there and check it out. I mean, what I love about Richmond, many things, but our location, we're like an hour away from the Appalachian Trail.
Yes.
Go out to Carter Mountain. We go every year, pick apples. You can be at the beach. You can, if you want to go to D.C. and get stuck in traffic.
If you get beyond the traffic, you can go to all the monuments.
Oh, yeah. It's great. My kids were up there yesterday at the National Zoo, which is cool.
Oh, yeah. Are the pandas out yet?
They are. It's spring break, so I saw the pictures.
Oh, that's exciting. That's exciting. I think that we need to look forward and how we're going to do this with innovation and what ways that we can tackle this. Do you have ideas that you would like to see people embrace that we should be talking about?
I mean, I have lots of ideas. Well, we've got to finish strong with this crisis build out. I mean, that's the big thing that I think, the tangible things that I can realistically accomplish before my job ends in 10 months is continuing to lean into that.
Right.
Because we already have the funding and the things in place for that. But building out those crisis, the receiving centers, the chairs and beds throughout Virginia. And, we're fine tuning our call centers. We're getting over 15,000 calls a month.
That's incredible.
It's a lot. And we've got our mobile crisis teams that can reach any Virginian within an hour, of the phone calls that don't get resolved on the phone. So continuing to refine that, because it is a brand new system. And so there are some bugs that we're working through.
Yeah. Well, you're still doing the hard work. If you had one thing that you would love to challenge Virginians to think about or do before we sort of wrap up our time together, what would it be? What would you ask them to work on and think about?
Yeah, just going back to that reclaiming childhood, I think that to me is something that we've got a whole generation that's growing now with just built-in depression and mental health care. And so we've got to be very preventive in our actions. And so how do we limit that screen time?
Yeah.
I mean, it's addictive. It is clearly addicting.
It is.
And so when you've got, these kids that are going to be joining our military, with some of these issues, and most of them aren't even fit to be allowed into service. That's kind of an issue.
Yeah.
Or any other workforce things.
That's right. That's
so,
right.
So
and do they feel the confidence to go out and do those things if they're dealing with behavioral health problems?
That's right.
And this, I think, is a nonpartisan issue because people can find different ways together to join community and live healthier outdoor lifestyles and active lifestyles with family if we can find time together.
Yeah.
Right. Time
there's
is
plenty of time.
Yeah. As long as we're not pulled in 25 directions and distracted. Right.
Prioritization.
Yeah. Well, it's been just a joy, again, to spend time with you. I always enjoy it. And just grateful for all the work you're doing and to your entire team. So thank you, DBHDS and Commissioner Smith.
Yeah. Thank you as well, all of you.
Thank you for listening to JoyMed, a podcast series I think you'll find very interesting and compelling, all dedicated to making our healthcare workforce healthier. Come back and hear us soon.